welcome. I'm Dr. John Minichetti. I'm one of the co-chairs of our AAID annual meeting. It's going to be in Phoenix, Arizona, May 12th through 15th. We are very excited. We have a star-studded lineup of speakers, workshops, table clinics, and lots of other stuff such as poster boards, etc., that's involved with our workshops and corporate sponsorship. So we're doing an interview today. I'm very excited to speak with Dr. Michael Pikos. Dr. Michael Pikos, as many of you are probably aware, is an expert and educator in implant dentistry. He's been doing it for 35 years plus. He's probably educated over 7,000 trained clinicians throughout the world. So I'm saying you got to be 60, 70 countries. An incredible person to know. I've taken many of his courses. He's been a mentor to so many of us, and we are lucky to have him with us. Thank you for coming on, Mike.
Thank you, John. Indeed, it's an honor to be part of the program. Looking forward to it, and really appreciate what you and your team have done to put together what I think is just an amazing cast of characters, if you will.
In implant dentistry, we are all characters, aren't we, to get into this field? So Mike is the epitome of excellence in implant dentistry. He's board certified with the oral maxillofacial surgery, and he's also board certified as a diplomat with our board of American Board of Oral Implantology. These are the types of clinicians who have a full understanding of implant dentistry. If any of you have seen him lecture before, you know his scope of education and knowledge. And he's going to be presenting at our AAID podium presentation. I know the name of your presentation. Do you know what you're talking about?
I do. I just happen to have it in front of me because it's more than a few words.
Right.
Basically, the evolution of full arch therapy, merging time-tested treatment principles with digital workflows. So a mouthful, but really, I'm sorry?
Tell us about your presentation. What's it involve?
Sure. I really excited about this one in particular. It'll be really one that's unique and will be something I'm doing pretty much for the first time, where I'm able to collate, 4 decades of my clinical experience in implant dentistry, but really distilling it down to some fundamental principles, at least that I see it, that have evolved over time. And having the benefit of practicing so long, we get to see our own patients ongoing, and not so much as restorative based individuals like yourself, but even as a specialist early on in particular, and even much later, I began to follow just a lot of my grafting patients to start, bone and soft tissue, and then ultimately full arch therapy type patients that I've been involved with since 2009 roughly. So looking at the entire spectrum, what I thought I would do is just share with our audience, which typically these are amazing audiences. I mean, as you know, I've presented in the past for AID, and just look upon this as the most prestigious academy that's out there for our respective work. And with that said, it gets me even more excited to know that I'll be able to present something very unique to our group, in that I will be able to cover a spectrum of concepts and principles that have evolved over time. And again, being part of all this time, blink of an eye, as you know, we talked about this before, now we got grandkids, and it's so exciting, a different era for us personally, a different dynamic certainly, but professionally speaking, I'll tell you, as I know you share the same thoughts, it's the R word just isn't in the vocabulary. Slowing it down is one thing, but walking away is a difficult concept, and especially when you retain the ambition of a young 25, 30-year-old person, and fortunately still have the cognitive abilities and physical abilities to continue to do our thing. I love sharing my work. I just have that passion for that. So with that said, again, just to put it in a nutshell, I think what my presentation really will be centered on showing the spectrum of kind of where I started with things, and how the evolution has occurred such that I can now share with our group state of the art full arch digital based therapies, yes, and including a little touch on what's I guess now termed patient specific implants. I've been involved with mandibular subs primarily for 35 years, and I'll show an inkling of some of that as well. So again, full spectrum. I'm excited to really be able to relate bone and soft tissue grafting concepts along with full arch therapy in general. And again, from a very high tech standpoint where we're at today.
Beautiful. Yeah, I know when the committee thought of you, we thought of bringing you in to give a true historical perspective, and I know you're going to deliver. So we're very excited to have you on the main podium, and I know you'll be around. So tell us a little bit more about AAID meetings. What makes them so special? What about those hallway conversations we have with you, Mike, picking your brains? Besides talking about the grandkids, what about talking about what happened like last week and how you dealt with it? What do you think about that education?
Well, I'll tell you the conversations over the years have been just outstanding. I mean, as you know, I think we get as much out of our evening and weekends, dialogues as we do from main podium presentations and workshops, et cetera. Finding out, more about the art as well as the science of what we're all doing, the business aspect of it. It's just
Yeah.
a great group of individuals that I have just honestly been so proud to be part of over all these years and interface with so amazing people. I mean, amazing from good old Lenny Linkow and
Oh my God.
and Hilt. God rest their souls. I mean, these guys were amazing
Absolutely.
pioneers and giants. And Carl Misch, of course. My
Oh,
goodness, can go on and on from there. But those are the three folks who really impacted me, as well as so many others, in a very profound way. And ironically, all of them, coincidentally, if you will, all part of AID over the years. So, that has been just above and beyond, the price of admission for any of the courses, any of the events that we have. Really, this supersedes all of it in my humble opinion. So it's really a family of professionals, but we share openly, and I think that's what's important. As they say, pros share, and the bush leaguers kind of hold back and all that and nonsense. But we openly share, and I love that. I truly do. And folks like yourself, I mean, honestly, the hours that have to be involved behind the scenes to put these events together, these especially the national meetings, just unbelievable. But that's a commitment that I admire, respect, and appreciate. And to be again part of this group to me has just been the ultimate of really my professional career.
well, I want to thank you, Mike, for being such a part of our AAID family. Hey, you can go anywhere, but you are the type that are down to earth and you can relate to your colleagues. And we really, truly appreciate all you've done for the AID with education and personally too. So thank you for all your support over the years. Hey, so what kind of advice do you have for younger dentists getting involved with CE? I'm gonna throw that out there as like a last minute question for you.
Sure, sure. I'll tell you, that's a great question. And it's one that I like to really address at even all of my courses. I close out with pretty much that item and topic in that the charge and the challenge, if you will, that I extend to all of our young colleagues is that certainly education is critical. It's really all about lifelong learning as I see it. It cannot stop. It's either retirement or death, whichever comes first, and the commitment level has to be there. As Carl Misch would talk about, we can't dabble in this game. It's dangerous if you do that. There's got to be a commitment, and not everybody's willing to do that. The old saying, want to go to heaven but don't want to die. It's called a commitment. So with that said, education is out there to be had, and certainly we have the ability via the internet to learn 24/7. That's a great thing, but there's nothing like in-person courses and meetings that we have, again, with AID in particular, on topics that are absolutely clinically relevant, but yet evidence-based. And I think that's what it's all about. And that's what my institute has been about. I've opened up my courses, as you know, for 35 years to everybody. I've never, ever even thought of discriminating against anybody for any reason. It makes no sense whatsoever. We're all in this together, and we need again to openly share our expertise and work. So the charge really is continue to learn. It just never stops. What's ever practical, but then keeping that balance factor too, because we can't forget our families. And I think that's a real big message that unfortunately isn't always shared across the board among ourselves as professionals. But as we get older, and you and I have had this talk more than once, that this discussion that really our family has to be there at the forefront. It's easy to get carried away. Oh, I've crossed that line more than a few times over the years. I'll say that where, we're so obsessed with what we do. It's our work is our play. Let's face it. So
Mm.
we can do it 24/7. But hey, listen, when you say yes to something, you're typically saying no to what? Your own family, your wife and kids. So that's a big thing. And I don't mean to sound, whatever here, but I believe that that message has to be shared with our younger folks to not get carried away. We've seen too many families destroyed because of that. It's an
Yeah.
addiction like anything else. We do love our work to the point where, to a fault sometimes. So, again, I've been as guilty as anybody else, honestly. But I've had, fortunately, a great spouse who understands a lot of what I do, but same time, get back in the right mode with your family, with your personal life. And so the balance factor, we all strive. I'm not even sure what that means a lot, but it does mean when you're with your family, your brain has to be there. And when you're with your work, your brain has to be there. Trying our best not to commingle those two because that's when things really go south. So that's, make I guess, a short story long. That's my answer.
That's some good advice. Absolutely good advice. And that's what the AID is about. Get some great education over these 3 days in Phoenix, Arizona. We'll have the main podiums and we'll have workshops for the younger guys wanting to get involved from anything from basic stuff to more advanced stuff, digital stuff, of course, all the restorative, prosthetics, surgical aspects. We have it all there. So we're really lucky. I'm looking forward to it. And Phoenix is supposed to be a really good place. I'm sure you've been out there a number of times lecturing yourself, Mike, but Phoenix should be wonderful in November. So we're really looking forward to a great meeting. And we want to thank you for agreeing to come speak at the annual AID 2025 meeting. Thank you so much, Mike. And thank you for the interview. Any last
No, I
words?
appreciate it. Well, just honestly, again, tickled pink to be part of this particular meeting. And as we discussed, there's some neat things down the road that we talked about too, or again, be able to share historically some important information that really cannot be conveyed pretty much by anybody else, only because of the unique background that I've got. So once again, very grateful, very humbled and honored to be part of this group in particular for so many years, and specifically for this upcoming meeting. And yes, Phoenix is a great venue, a lot of neat things to do, great weather always, and once again, most importantly, great people.
Super. I think I'm going to try one of those cars, the driverless cars out there. All right. Check me out. Come out to Phoenix. Come out to Phoenix in November. We'll talk to you soon. AAID.com.
Thank you.
Bye bye.
Thank you. Bye bye.